Next up, we have a conversation with three Active Minds partners who specialize in digital mental health and have been leading efforts to address mental health, particularly during the pandemic. Sanvello, Togetherall, and TimelyMD all have a unique approach to responding to mental health needs in an effort to increase accessibility and meeting people where they are. Welcome Chris Clark, co-founder and chief strategy officer of TimelyMD, Matthew McEvoy, senior vice president of Togetherall, and Dr. Monika Roots, chief medical officer for Sanvello. This conversation will be moderated by Active Mind's own chief programming officer, Laura Horne. So I'll pass it to Laura and she'll take it away from here.
Thank you, Kai. Chris, Matt, Dr. Monika, thank you so much for joining me. I'm very honored to have you all here, and I've been looking forward to this conversation very much. Over the last year, there's been a question that's been constant on my mind, which is just wondering if we're seeing more tech use among young adults to support their mental health during the pandemic. We know that many campuses in particular have been extending their services and inviting more tech tools in their suite of services. I'm also wondering if, assuming use is going up, do we have more test cases to use? Are we getting more data and understanding about how digital tools can support mental health going forward? And I know that each of you and your teams have played a critical role during this time in helping to connect youth to those tools. So thank you so much again. And because I know you each provide something very different, I thought I'd start by allowing each of you to introduce yourselves and your organizations. And Chris, I will start with you if that's okay.
That's perfect. Thanks so much, Laura. My name is Chris Clark. I'm the Chief Strategy Officer and one of the founders of TimelyMD. TimelyMD is a telehealth company that was built for and is solely focused on students. So we have a medical offering, we have behavioral health support, and hopefully we can talk a little bit more about that through the conversation, psychiatry and health coaching. And I'll just say two things, Laura. We're absolutely seeing an increase, and I'm sure that Dr. Roots and Matthew will talk about that as well. And then the other thing that I'll just mention while I have the microphone for a second, I wish I had dressed a button-down TimelyMD shirt, or I looked as nice as Matthew or Dr. Roots. But I live in the Dallas-Fort Worth area. I'm in Florida and I cannot get home. So I am doing this panel from a hotel room, and I brought one polo shirt. So hopefully that is okay for everyone attending today. But thanks for having me, and thanks for having TimelyMD.
This is a very safe space, non-judgmental. So I will set that right now. Matt, how about you?
Sure. Yeah, thanks, Laura. I'm really happy to be here. Normally my preferred outfit is the same as yours, Chris. I did all button up today just for this. But yeah, I as Laura mentioned, I lead our work at Togetherall. And what we've created is a safe, inclusive, digital peer-to-peer mental health community that is it's being used at close to 300 institutions across North America and into the UK. And has access to over 2 million students in that community. And we talk about it being a safe community because it's monitored 24 hours a day and moderated by licensed mental health professionals, mostly social workers doing that work. Just a bit about me. I've spent my entire career in remote-based digital mental health, which is now bumping up on 20 years. So, aging myself a little bit, but student mental health is something that's been near and dear to my heart for the vast majority of that. And I actually sat on the technical committee, I think, for the world's first post-secondary student mental health standard that was released from the Mental Health Commission of Canada in the back half of last year. So I'm based in Toronto, so a little different temperature than where you are, Chris.
Awesome. Thanks so much. And Dr. Monika.
Thanks so much for that question, Laura. So I'm Dr. Monika Roots. Hi, everyone. I am the Chief Medical Officer of Sanvello. It's a full virtual care solution for mental health. So we have self-care, we have mental health coaching, teletherapy, and telepsychiatry. And I, like many here, have been working in virtual care for well over a decade. I was previously VP of Health Services at Teladoc, which is a huge global telehealth company, and came to Sanvello to really build what I've always wanted, which is really a full spectrum of services. So when we looked at 2020 and COVID, the increased need was exponential. So if you looked at data, there was a 40% increase in just people saying, I have more depression, I have more anxiety, I have more stress. And 25% of that was young adults, people in college who are raising their hand and saying, I need something. So Chris, just like you, who needs virtual services right now to be part of this panel, so many people were needing help. And so part of what we saw was we released something called Free for COVID, which was giving all of our self-care tools away for anybody who needed. And we just saw an exponential number of people raising their hands. So it was really an opportunity for people to be able to access the services that they needed when they needed it.
Okay, so it's clear demand may be up. And Matt, go ahead.
I was going to say, I didn't actually answer the question that you asked. I just introduced myself and moved along. So I give just a quick short answer to that initial question. And yeah, we absolutely saw a significant increase in usage. We've been doing this work for a long time. Between sort of February to March, when the pandemic was declared, we actually saw a 230% increase in the number of new members into our digital community, which is the highest spike that we've ever seen in a month-over-month period. I think just, you know, all the things that have been raised around isolation and anxiety that I know we'll get into today. And so lots of use cases, I think, within that since the pandemic has started, which we'll get into.
Okay, so it's clear that tech use is up, which I think is probably some good news. I know even before the pandemic, Matt alluded to this a little bit, but we saw depression and anxiety on the rise among students even before the pandemic. And wondering, I think one question that everyone has on their minds is around marginalized communities and their access to services, having seen a disparity before the pandemic in terms of access to care for people of marginalized identities. And just, I think there's been a lot of hope and wondering if maybe technology can help bridge that gap a little bit. I'm just curious if you all have learned enough yet about, especially with the increase in use cases, and how we might be closing that gap. And Matt, can I start with you this time?
Yeah, sure. So I think it's really interesting. Our community is on the front face of it is anonymous. And so what we tend to see, and I think we've seen this for years, is students who may not otherwise reach out for support in normal situations, whether it's coming to campus and that sort of thing. And we've absolutely seen an increase in that. So 40% of the students who've used the service are not telling us they're not seeking support anywhere else other than in our digital community, which is really interesting. And we just took a look at some of the data from this first semester, kind of August. It's sort of the first full semester where we've had COVID in place, and found that 40% of our members actually identify as BIPOC. And so we are really reaching a percent of the population, which I think is often underrepresented in campus counseling centers. And we really believe that it's the anonymity that has something to do with that, and it allows for a really safe and inclusive environment to come in and share how you're feeling and how you need to be supported.
Great. Chris, how about you?
Yeah, so I'll mention, well, one thing I do want to highlight one of the things to your question before. So over the past year, what we've seen is the demand for medical services and behavioral health services almost be reversed. So as a comprehensive telehealth solution, around 2/3 of our visits this time last year were medical, right? And so you can think of any, various conditions that were presented through the platform, and a little less than maybe 35% of the visits were behavioral health. Those numbers have reversed. So when you look at the total utilization of all of our products, approximately 30 to 38% are now medical visits, and more than 60 are behavioral health. So as it pertains to, I think what I can kind of add, we've seen the demand for services from marginalized communities. It's been a very strong demand. And so I know as a part of our panel today, we have students, and then we also have administrators and other stakeholders within higher education. And one of the things that we're asked all of the time is, does your provider network represent the population that you're serving? And we've worked very hard. So 48% of our behavioral health professionals are persons of color. And then we also look at who are we serving, and do we have people that look like the people that they're serving? So as we've done kind of internal market research with students, when we're looking at satisfaction surveys and what's most important to them, one of the things that bubbles to the very top of the list is, I want to see someone who looks like me. So that will depend based on the population that we're serving, but that's one of the things that we're working really hard on, and we're continuing to strive to be an organization that can kind of meet students where they're at.
Makes sense. Dr. Monika, what would you add?
I would echo everything that everybody has said today, but I think what was so crucial about 2020 and what we've been seeing all along is that it gave the opportunity for people of all walks of life to make the leap to really help their mental health day by day without taking a physical step. That's huge for people who have not taken a step, raised their hand before, and we were there to help them. So just like as we talked about, I think peer support communities, which we have, is so important. But what we were able to do with the help of technology also is to have individualized communities for people to support each other. So for example, we have LGBTQI. We have a peer community so they can support each other. Black Lives Matter, staying socially connected during COVID. Sometimes having a specific topic of supporting each other brings that dialogue out. But I think the other thing too, and why we're seeing such a flood of many different kinds of digital solutions, is that there's multiple on-ramps to supporting your mental health. People raise their hand differently, and that's okay. It's a step, right? It's that digital step that we want. And so for example, in coaching, we see actually more males than females using it, who are typically people who never go to therapy, right? Because they see it as a weakness. I say go for it, right? Let's get them in, because we can always steer them to other resources that might be useful for them. But what a great time for people to actually have those solutions available to them.
Monika, I need your help. Our data is not showing that. So around 80% of the use with coaching on our side is from females. Now we'll have some institutions where that number is lower. So I won't take the time today, but I need to talk to you, and I need to find out what we need to do to make
Absolutely.
sure that all of the gentlemen are accessing services when they need it.
Absolutely.
That's really promising, and also pretty good news. I was wondering, Dr. Roots, you mentioned about the plethora of mental health virtual apps and other types of services out there. What should young adults be looking for? What factors should they be prioritizing when they're looking for the best tool for them?
Oh, that's a big question. A lot of things. So one, as we talked about, take a step, right? I don't think that one should step back and not take that step because it's just so overwhelming. Pick one. Let's get into the lane, right? Like, let's make that train leave the station. Second thing, though, of course, is security, safety, making sure that that solution aligns to what you need, right? So as Chris so gracefully put, a person feels like it's difficult to open up if that person doesn't get where they're coming from. And so finding those solutions where you can have that support is so important. But then I think what's going to rise to the top is quality. Just because a person engages, if they don't get better, what use is that, right? So I think the ones that are going to be here to stay really look at all of those tenets. So they look at safety, they look at experience. If you don't use it, you don't get better. And if you use it, do you get better? And can I find that support?
Those are all great tips, and I think really important. I think that's a key question. Matt, I want to turn over to you for a question. We both share a belief and valuing of peer-to-peer connection in supporting youth mental health. Can you speak a little bit about how Togetherall is providing opportunities for social connection during COVID?
Yeah, absolutely. And I think, our focus, I think maybe a little bit different to the folks at Sanvello and TimelyMD. Really, our focus is on creating safe spaces and being an inclusive and supportive community that people can feel that they belong to, right? We know, what a difficult time life is now, but around isolation and loneliness, we know this existed long before, right? I mean, there's great data from ACHA, from the Healthy Minds Network, to show that isolation and loneliness were a massive concern across campuses. And then, even the Active Minds survey that showed that 80% of students are feeling more lonely and isolated during COVID. And so that's really where we've spent the time to focus on is giving a space for students to find that connection to people who are like them. And it's very often that first point where a lot of students who maybe don't feel like they belong in their campus or haven't found a like-minded person or someone who really gets or feel like they've been heard to come in to a safe space and find that connection and then be able to get them to the right space. And it may not be that peer-to-peer is for them, but helping and hearing what others who've been through that same shared lived experience and how they've been on their journey might give them some ideas and maybe make them feel a little more comfortable to reach out to some of the great other telehealth supports that are out there, like at Timely and a Sanvello.
Okay, Laura, do you mind if I mention one
Please
thing?
do. Please do.
I think I love hearing what Dr. Roots and Matthew say. It seems like we all were reading from the same book, which is great. Another thing that we try to really impress upon the students that we serve is that no issue is too small, because there may be roots to something. So one of the things that we do, it's called Talk Now, and it's coaching services for anything, right? And so what we will see, and especially you mentioned marginalized communities earlier, they think, oh, this isn't something that I should seek help for. This isn't something I should talk about. And there's almost this negative cloud over seeking help. And what we're trying to do is to say, come talk to us about anything. And so we have, and I'm not a behavioral health professional, so Dr. Roots can correct me here in a moment, but what I've seen, we've had people call who have said, or, engage with us on the platform that have said, my roommate ate all of my Cheetos. Well, I kind of thought that was funny. And then I was talking to our care team, and they said, there could be food insecurity there. There could be deeper rooted issues that person may need to talk about. So I would say what we do, and especially through the Talk Now platform, is talk to us about anything, whether you think it's small or whether you think it's something big.
Yes, that resonates with me so much, because I think that's a frequently asked question is, when is it time to seek help? And we always say, it's never a bad time to seek help. And I think what we run into is just making sure that help is there. As we're increasing help seeking, we need a system that supports and is available when young adults are seeking help. And I think that's one of the things that you all and other tools like yours can do, is increase and expand the capacity to be there when young adults do take that step, knowing that it can be difficult for them to do for the first time. Chris, there's been a lot of buzz around telehealth lately, and what I constantly hear is, well, telehealth is great. It's no substitute for in-person. In-person is better, but if you can't get in person, then try telehealth. And I'm wondering what you think about that, what you would tell anyone who might be skeptical about the potential for telehealth to meet people where they are.
Yeah, great question. I'm very interested to hear what Dr. Roots has to add to follow on to this, in the same way with Matthew. So here's what I would say prior to let me preface my answer with, we do not think we are a replacement for in-person care and for face-to-face care. Our organization, the optimal partnership looks like an extension of the care that's being delivered on campus. and that we're a partner to the counseling center, to the medical clinic, to the services that they have within their healthcare infrastructure. Now, to kind of answer your question, the utilization of virtual care services, and if you guys have different statistics, please correct me, but if you look at 10 to 12 years ago, utilization of virtual care was very low. A 5% utilization rate was high. In the past 5 years, you've had people publish when they've got to utilization rates of 10 to 20%. And we've just blown right through those numbers during COVID. And so what has happened is now there has been a spotlight on virtual care and its ability to take care of students virtually. So on the medical side, again, we don't think we're a replacement, that around 75% of all conditions that would be seen in a primary care office or an urgent care office can be dealt with virtually. If it can't be, then the virtual healthcare provider, licensed medical provider, needs to refer them to in-person services. On the behavioral health side, and I'll try to hurry because I want to make sure Dr. Roots and Matthew have time to talk. On the behavioral health side, they have done studies and have really seen that the efficacy of virtual care is very close to in-person care. So I think the in-person care still has a slight edge, but especially as you think about the isolation that has been brought about by the pandemic, the ability to be able to access services virtually has been very well received, and the efficacy rates when you look at it virtually is high. Dr. Roots?
So I'm going to add in there. So having practice for in virtual care for 13 years, I can tell you it can be even better than in-person care for certain conditions. So what the studies have shown that it could be comparable to what you get in person for mental health services. But what the added piece of that is it offers the opportunity to actually have full care. So let me dig in a little bit more by what I mean by that. So, the typical mode of people seeking care is one, meaning that the average person goes to see a mental health provider and only gets one visit. The average number is 4. But the actual course of cognitive behavioral therapy, which is a care for anxiety, depression, and stress, is at least 9 to 12 sessions, meaning that, boy, no wonder we have a capacity problem. People are not getting enough care. It takes a lot of motivation. We are asking people who are depressed, who have low motivation, anxiety, it's hard to go outside, to leave their area and go to a clinic to get care. So what we have found is that through virtual care, people are able to do it from the comfort of their own home, their own bedroom. They tend to open up more. From a clinician standpoint, I can see more. I can see if, things don't look so tidy at home. I can see how they're doing in their natural setting. That helps me. And then the additional part is there have been people that are lost to follow-up, right? So people who have schizophrenia frequently don't show up for follow-ups. People who have agoraphobia, which means they're afraid of going outside, don't seek care. People who have OCD have trouble going to care. So we have a real opportunity here to care for individuals at any level who have needed care before. But the other piece that's so cool about digital services is that one size does not fit all. Not everybody needs a therapist. Some people need a coach. Some people need peer support. Some people need self-care tools. Because here's the thing about the mind. We know that, your teeth, what do you do every day? You brush them. You want to keep them clean. What do you want to do for your muscles? You want to walk every day to keep your muscles strong. Same thing for your brain. You need to strengthen it every day. It is a muscle. And no matter how well we're doing, everybody's got stress. You have the opportunity to be 1% better the next day, right? So I think with the opportunity of digital care services and full spectrum services is that you can get people better and keep them better while doing evidence-based care. That's pretty unique in this field.
Matt, anything you wanted to add?
Yeah, I think that spectrum is really so important, and I agree with everything you have to say there, Dr. Roots and Chris, and keeping that sort of resiliency is really at the core of it, and what can you do in some of those lower level of intensity type interventions, like there's lots of great kind of mindfulness tools within within Sanvello. You know, we know a lot of the clinicians that we work with and our campus partners kind of prescribe use of Togetherall in between sessions and after the course of counseling. So we know that providing peer support to others has such great protective factors in supporting your own resiliency and maintaining your own recovery. And so to Dr. Rutz's point, that being able to do all of this now digitally and not having to rely on in person, where there's so many barriers to get access to that kind of care during the whole spectrum and during the whole course of treatment and supporting recovery, I think is it's a really powerful plus to the digital mental health movement that we're seeing.
Okay, awesome. So our theme for the conference is here to stay. And by that, we mean mental health is becoming more and more a part of the conversation, and we want it to be here to stay. We don't want to go back. We want to keep the momentum around proactive mental health care. And I'm wondering, certainly digital mental health is part of that. We hope that with the increased use of digital tools that more service providers, counseling centers, and youth will take that step if they'd like to through digital tools. I'm wondering what else you all are excited about the future, given what you've been learning over the past year and what you've seen.
There's so many opportunities. So, you know, like through digital care, there's the opportunity now to look at other metrics. How much are you moving? How much are you sleeping? There's an opportunity to use virtual reality to really get at some of the conditions that are hard to do what we call exposures. So really getting them in a real life setting to tackle their anxiety might be hard, but maybe you can do it through virtual reality. Maybe we can look at your voice intonation as you're talking and maybe detect your depression earlier than you may have known, right? So all of those are opportunities for us to get people into the right care, effective care, but early intervention. And so those are things that clinicians can use, doctors can use to be able to help their individuals as much as possible. And then can also be extensions into, you know, the clinic setting to the hospital setting, so that that care continues to be continuous, right? So frequently in mental health, there's a lot of silo, meaning that information is not exchanged, but through digital, there's the opportunity for that data to be exchanged, which results in better care.
One of the things I'll add, Laura, at TimelyMD is we have a student ambassador program, right? And these are students who are active and engaged and believe in using the platform of improving overall mental health with a total student population and then student by student. And I wish I was closer to college age. I'm 42. I had to learn the term of influencer a couple of years ago. And so it's probably old news now, right? But one of the things that we look for is who wants to be, you know, an active ambassador for virtual care services. And some of that's just like what Dr. Rutz was talking about, encouraging others to use it. Then you'll have some people that proactively share their story, right, on social media. We look to student government officials and see how they can get involved in what we're doing, because, and you know, Matthew talks a lot about the peer-to-peer connection. They may listen to their peers. I already said, I'm an old 42-year-old guy who is saying you need to seek services, but they may listen to people, the student class, the class president or the SGA presidents. That's one of the things that we try to do at TimelyMD.
Matt, you want to jump in? Something you're excited about for the future?
Yeah, I think I'm just so excited that it feels like our field, for the first time in my time in it, has come into the spotlight, right? And it's not going away. This is now, I remember when I first got into this space, talking at parties and things like that, people wondering what I did, and kind of people would quickly change the subject. And when we got talking about mental health, and I remember feeling like I was a bit of a downer at the party with talking about some of the serious stuff that I do on a day-to-day basis. And those days are gone. They really are. And the number of folks just in my my life outside of my professional circle who are now talking about this and really interested and want to learn more and want to get involved and want to understand how we can use some of these digital tools to kind of raise the voice of people who have that experience and lived experience is really, I think that's the most exciting to me. And there's so many things to use technology or not, but this spotlight is now just not going away. And I think that's probably what I'm most excited about.
Agree with you 100%. And we'll add that, I think what we see in terms of mental health issues among youth is a challenge ahead of us. And I think we're going to need new solutions. We're going to need out of the box thinking. We're going to need to meet people where they are instead of always expecting them to meet us where we are. And I'm excited that hopefully through the increased use of technology during COVID, people are feeling comfortable with those tools. We're learning more about how they can be integrated into a larger system of care for young adults, but for all. And that we might, through these solutions, be able to make some progress towards improving mental health, especially among young adults. So I'm very, very grateful for all of you and the work that you do, and I'm cheering you on and your teams as you meet a challenging scenario that we have on our hands with COVID and youth mental health. So thank you for all that you do. Thank you for this conversation, Chris, Matt, and Dr. Monika. It's been great to speak with you. So thank you for giving us your time. I'm going to let you all move on with your day, and I look forward to hopefully seeing you in person at next year's Active Minds National Conference.
Thanks so much, Laura.
Thank you all.
Thanks a lot for having us.
Thank you very much.
Thank you.